Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We're going to be talking about protests and advances in medicine and what Trump is doing to healthcare. But before we do, let me point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter that is the text for this video. It has all of the hyperlinks to news stories, background material, medical publications, as well as a host of references that you might find useful for your own healthcare or reproductive healthcare, and a bunch of links to organizations that are fighting for better healthcare for all of us. So let's get started. Take public action against the Trump agenda. Public protests are really important. Now, my wife and I live in Vancouver, Washington, and we have been protesting against the Trump-Musk illegal assaults on federal agencies and workers. Now, Monday is February 17th, 2025, and we're going to be in Esther Short Park at noon protesting against this current president. There is an organization called 5051. I'll put a link to it in the YouTube description box, also in the newsletter. It's a grassroots organization, and it lists a host of upcoming protests nationwide. Go there if you're interested. Indivisible is another good place to align with, and I'll put a link again to their website. You can get started with them, or Mobilize. I'll also put that in the YouTube description box. Mobilize lists lots of events based on your current location. Look, you can also call your member of Congress and your senators, and you tell them not to abandon their obligation to represent their constituents by allowing Trump and Musk to carve up the government. Of course, down in the YouTube description box in the resource section, there is a link that will take you to the phone or email for your representatives. Now, let me remind you one more thing. Here's a protest everybody can do. February 28th is a national day of protest. Buy nothing. Let everybody know that the economy can come to a halt on that day. Whatever action you choose to take is great, but please take action. Let's talk about halting gender-affirming care, because not so fast, Trump. A federal judge on this last Thursday, that's February 13th, temporarily blocked Trump's recent executive order aimed at restricting gender-affirming health care for transgender people under 19. The judge's ruling came after a lawsuit was filed earlier this month on behalf of families with transgender or non-binary children who allege that their health care has already been compromised by the president's order. A national group for families of LGBTQ plus people and doctors' organizations are also plaintiffs in the court challenge. It's one of many lawsuits opposing a slew of Trump's executive orders. The ruling, it's in effect for 2 weeks, essentially puts Trump's directive on hold while the case proceeds. The restraining order could also be extended. The lawsuit includes several accounts from families who had appointments canceled because medical institutions decided to react immediately to the new directive. Attorneys for the plaintiffs argue that the executive order is unlawful and unconstitutional because it seeks to withhold federal funds previously authorized by Congress, and because it violates anti-discrimination laws while infringing on the rights of parents. Like legal challenges to state bans on gender-affirming care, the lawsuit also alleges that the policy is discriminatory because it allows federal funds to cover the same treatment for minors when not used for gender transition. You can find a link to the MedPage Today story on it in the newsletter. Bad news, RFK Jr. was confirmed to head Health and Human Services. He's one of Donald Trump's most controversial cabinet picks. He's been sworn in as the next Secretary of Health and Human Services. The former presidential candidate will now oversee the key health agencies with about 80,000 employees and $1 trillion budget. Lawmakers on both sides of the aisle questioned his baseless health claims and vaccine skepticism. Was confirmed by a 52-48 vote. No Democrats voted for him. And here's an interesting point. Mitch McConnell, who I have lots of problems with because he's just a nasty, nasty piece of work. Former Senate Majority Leader Mitch McConnell was the lone Republican to vote against him. Let me tell you something. It wasn't just poking an eye at Trump. It's because he had polio as a child, and he knows that vaccines are important. And Trump's lawyer, not Trump, sorry, RFK Jr.'s lawyer has filed paperwork with Health and Human Services, and with the FDA to get the polio vaccine declared not for public use. These guys stink. Anyway, let me talk to you about vaccines. It is a sad day for public health in our country. I want to urge all of you who have children to download the CDC recommendation on vaccines for children and adolescents. The link is in the newsletter. I'm also going to put a link to a saved PDF copy on my healthcare advocacy webpage. So if you go to the newsletter, you can go to the webpage. You can get the resources there as well. It's at the bottom of the newsletter. I'll leave it there like in perpetuity. Abortion bans and infant mortality. A friend of mine sent me this article, and it's very distressing. It's from the Journal of the American Medical Association. This last week, on February 13th, 2025, the Journal of the American Medical Association published an analysis of how complete or 6-week abortion bans affect infant mortality. Of course, there's a link to the report in the newsletter. Here was their question. Was the adoption of complete or 6-week abortion bans associated with a change in infant mortality? If you're going to do science, you should always ask a question first. Findings. The analysis of U.S. National Vital Statistics data from 2012 through 2023 found higher than expected infant mortality in states after adoption of abortion bans versus expected, 6.26 versus 5.93 per 100 live births. Relative increase was 5.6%. Estimated increases were relatively larger among infants who were Black, had congenital anomalies, or were born in southern states, meaning abortion bans are associated with increases in infant mortality. These increases were larger for populations that already experienced higher than average rates of infant mortality. The study examined infant mortality rates in the 14 states that implemented complete or 6-week abortion bans and compared them with predictions of infant mortality rates based on pre-ban mortality rates and states without bans. Data included all live births and infant deaths from all 50 states and the District of Columbia in those years, 2012 to 2023. The models accounted for temporal trends and state-specific factors, with analysis stratified by race, ethnicity, and the timing of death and the cause of death. Conclusions, here they are. U.S. states that adopted abortion bans had higher than expected infant mortality after the bans took effect. The estimated relative increase in infant mortality were larger for deaths with congenital causes and among groups that had higher than average infant mortality rates at baseline, including Black infants and if you're in the southern state. Nice going, Supreme Court. You care about people? Not at all. Entire government is now focused against Planned Parenthood. Anti-abortion activists and their allies in the government are hoping that this is the year they finally take down Planned Parenthood by going after federal funding that makes up more than a third of the organization's budget, with efforts moving simultaneously through Congress, the courts, and the executive branch. The Supreme Court announced this week it will hear arguments in April on South Carolina's ability to strip Medicaid funding from Planned Parenthood, a landmark case that could prompt dozens of GOP-controlled states to take a significant bite out of the organization's finances. You can find a link to the story in Politico in the newsletter. Let me point something out. There are a large number of women who cannot afford to go to a doctor. They go to Planned Parenthood. They are seen and treated for a wide variety of conditions. They pay based on a sliding scale in their ability to pay. What Planned Parenthood does is help people who otherwise have nowhere to go. Planned Parenthood provides, listen closely, vaccines, wellness and preventive care, cancer screening, prenatal and postpartum care, contraception, mental health services, HIV treatment, sexually transmitted disease treatment, and yes, also abortions where legal. You can find a link to that in the newsletter from the Planned Parenthood website. Second, none of the money the federal government provides to Planned Parenthood as fees, as Medicaid fees for services for the poor, is used for abortions. Not one penny. The Republican anti-woman hooligans in the government are counting on everyone associating Planned Parenthood with only abortion so they can close it. Don't let them do it. Here's an action most of us can take. I have a link in the newsletter, and I'll put it on the YouTube description box, to the Planned Parenthood website. Let them know their services are valuable for women and families. Click on the box in the upper right-hand corner. Make a donation to them. Anything will help them. Okay, that's what I've got for you. Down below, you can like, share, subscribe, send me comments here on YouTube or at healthcareadvocacy1, all one word, @gmail.com. Have a good weekend.